Our next significant contribution has been from the Duke Health Systems, University of Duke. With their launch of speedometer, I think NATHEALTH has really gained and understood a lot. Particularly, we have to thank Dr. Krishna Udaya Kumar, because he has really worked with Siddhartha, the NATHEALTH team, to be able to bring significant knowledge again into the way we handle healthcare. More than that, there have been life-saving technologies, interventions, acceleration, and the fact that this whole vaccine scaling up with the speedometer, building vaccine confidence, all this will really help us in our healthcare agenda. So I'd really like to thank Dr. Krishna for working together. The signing of the MOU again has been very important for us, because NATHEALTH is just a 7-year-old organization, but it's the valuable partnerships which have really made us what we are, and will continue to do this and help us grow. So I would like you to speak to us, and then we will have the MOU. Thank you, Krishna.
Thank you, ma'am. Before we proceed further, if I can just take the opportunity of introducing Dr. Krishna Udaya Kumar to our audience. He's the director of Duke Global Health Innovation Center. He's the founding director, in fact, ladies and gentlemen, and he's focused on generating deeper evidence and support for the study, scaling, and adaptation of health innovations and policy reforms globally. He's also Executive Director of Innovations in Healthcare, a non-profit co-founded by Duke, McKinsey and Company, and the World Economic Forum to curate and scale the impact of transformative health solutions globally. Over to you, Dr. Krishna Udaya Kumar. Welcome.
Thank you for such a warm introduction and welcome. On behalf of Duke and all of my colleagues, we're really honored to enter into this collaboration with NATHEALTH, and I share my special thanks to Ms. Preetha Reddy as well as Mr. Siddhartha Bhattacharya for their strong leadership and collaboration to make this possible. We've had the pleasure of working with NATHEALTH over the past several years on the innovation space, and now really are looking forward to advance those collaborations significantly. From the global perspective, we really see NATHEALTH, even as a young organization, as a model for strong private sector engagement, as well as leadership to improve health and healthcare at what is now a critical time for health in India, as well as the rest of the world. And one of the opportunities we think is here is really to learn from your amazing work, the partnerships, the collaboration also with the public sector, to be able to set an example for the rest of the world. Here at Duke, through our Global Health Innovation Center, our affiliated nonprofit Innovations in Healthcare, our broader Duke Global Health Institute, we bring a very strong commitment to improve health and healthcare in India, and also to share those lessons we generate together with partners to others around the world. We're especially excited that we have 3 areas of priority in the work that we'll be doing going forward. One is on this COVID response. We know that we're nowhere near the end of the current pandemic, and what we'd like to understand is the positioning of a positive role for the private sector in everything from building vaccine confidence to strengthening vaccine implementation to getting stronger research and data around COVID response. The second is to look more broadly at the innovation ecosystem in health and healthcare in India, bringing together players from industry, from academia, from startups. And to help with that, we now, through Innovations in Healthcare, have a network of more than 30 growth stage startups in India, coupled to a network of more than 100 globally operating in almost 100 countries. And the third area we're really interested in is this broader opportunity to generate stronger research, knowledge sharing, and joint events, and really to use that as a mechanism to tee up reciprocal learning opportunities between India and the rest of the world. So we're very excited to be part of this collaboration. I share my special thanks to all of you, and look forward to working together for many years.
Thank you, Krishna. It's been truly valuable for us, and we're looking forward to doing multiple things together. I think one of our near-term agenda was building vaccine confidence. And there's a lot to be done in the country. You know, continuously we've been engaging with people to see how we can do that. Again, innovation, as we spoke about it, India really needs quick interventions, innovative interventions, and maybe even in the devices. So I think that's really been amazing. Knowledge sharing, I think you've been very magnanimous. You know, time spent, you've given us all the knowledge which has been available with Duke. We will do some joint events and research partnerships. So I think the future really holds a lot of excitement. Having said that, Aishwarya, do we have a formal, like a signing event? Or are we...
No, ma'am. So this is the announcement of the MOU. In fact, this is actually the announcement of the fact that NATHEALTH and Duke University have come together for this long-term partnership
Perfect.
in areas of research and innovation.
Okay, Krishna, so thank you again. And this will be a great partnership for both of us.
Thank you.
So with that, I'd like to really thank Dr. Reddy once again. Thank you so much, ma'am. Thank you to Mr. Mukim, and thank you, Dr. Kumar.